So, talk to me about the power that you've seen of health literacy for organizations. And then, do you see a trending need towards them being open to mental health literacy?
When we think about health outcomes, the data tells us that 80% of health outcomes are driven by social determinants of health, which is where do people live, work, and play? And some of the determinants of health are things like access to care, health literacy, environment. All of those things from a overall health perspective come into play. It's not just literal access to care in terms of is there a doctor within XYZ radius, but are you able to get yourself to work, get care for your children, for example, to be able to go to an appointment? Or are you able to take time away from work to actually get access to care? Those things also relate to a mental health perspective. When we think about traditional health literacy, it's people being able to make informed choices. We're not talking about the people that know that they have a challenge and they're not in a place from a stages of change perspective where they're ready to do something about it. It's the people that may not even know, understand, or realize that there's a problem and may not know what to do next once that they identify that there's an issue. And we've started to talk about literacy in the context specifically of mental health literacy, financial literacy as well.
Right. Yes. Yes.
It's all related. And no, we're not going to be able to change everybody. But when we think about moving the needle, it's for the people that don't have the power of knowledge, education, and information. How can we at least solve for those barriers? Simply through informing them